Welcome to today's COVID-19 update for Tuesday, December 21, 2021.
We have 761 cases that are active. Over the last 24 hours, we would have seen 35 new cases, and we continue to see the majority of these cases that are active being in Region 4, Region 6, and Region 3. We currently have 38 persons in hospital. 28 of those persons are at the Ocean View Hospital, with 8 of them being in the ICU. And we have 5 persons on ventilators, so we continue to monitor them. So in terms of our vaccination, for first dose adult, we are currently at 79.8% of the adult population getting a first dose vaccine. That would mean that 409,254 persons would have received their first dose vaccine. And for second dose adult, we are at 56.8%. That means that about 291,473 persons would have received their second dose vaccine. So we continue to monitor this and try to get more people to get vaccinated. So in Region 1, for first dose, we are currently at 85.2%. Region 2, we are at 63.9%. Region 3 at 76.8%. Region 4, we are at 89.6%. Region 5 at 79%. Region 6 at 78.8%. Region 7 at 81.8%. Region 8 at 51.3%. Region 9 at 76.1%, and Region 10 at 39.1%. Now, from these numbers, looking at our first dose, we would see that Region 10 remains extremely low at 39.1%, and Region 8 at 51.3%, followed by Region 2, which is at 63.9%. So these are relatively low numbers, and it is even worse when we look at the second dose because they're all really lagging behind. The way that the virus would infect people generally is when you breathe the virus in. So if you're not wearing a mask, the virus would be transmitted through the air into your nostrils and then into your respiratory system. If you're drinking, obviously that's not where you put the drinks. You don't put the drinks in your nose. So that's not going to help.
Minister Anthony is urging persons who want to socialize during the holidays to ensure that they do so in an environment safe from COVID-19.
What we need to be very concerned about, I think, is that persons who go to bars, and especially those bars that are not adhering to the regulations, meaning they're not checking people at the door to see whether they are vaccinated or not, which would then mean if they're not checking, there would be people who are there who are probably unvaccinated, who would be at a higher risk for transmitting COVID-19. When you are in a bar, generally, you go there for a drink, I don't think people would be wearing on their mask in close proximity. So the chances of spread is much greater in indoor environments and in environments like bars and restaurants. So we have to be extremely careful about the places that we visit during the holiday season, the duration of time that we spend in these places, and a big warning sign should be if you go to a restaurant or you go to a bar and they're not checking for vaccination status. To each of the vaccine, there are specific recommendations on what type of boosters should be used. And while SAGE, in settings where you don't have many options in terms of vaccines, they have said that you can mix and match vaccines. They did not specifically recommend that for Sinopharm you should use Pfizer. However, SAGE has advised that you can mix and match, and the manufacturers of Sinopharm has said that if you're going to boost, that you should boost with the similar vaccine to use that as the booster. In Guyana, we have used Sinopharm. We have Sinopharm vaccines that are available. So those who already received 2 doses and they're eligible for their booster, they should come and get their booster, and we have those vaccines available.